You have any favorite one or two studies that point to a sort of naturally occurring example of how people can become very fit in one area and not another? I'm familiar with seeing endurance athletes that apparently have terrific endurance, but at least to my eye, don't look like they are particularly strong. I'm also familiar with seeing individuals that are very, very strong, particularly on social media, but that don't look like they could walk up a flight of stairs, much less run a mile. Do you have any examples of studies in or outside the laboratory that point to that in a concrete way?
There's a lot to discuss here, but I'll answer it really clear. If you look across the literature, and this is actually back to as early as the mid-1950s. In fact, it actually goes back to previous to that, to the Harvard Fatigue Lab, 1927 to 1947 area. People actually were advocating at that point a combination of strength training and endurance.
In the 1920s?
Way back then. In fact, it actually goes prior to that, the late 1880s. There's scientific evidence back then. It became more well-developed in the mid-1950s and 60s. In fact, there was the initial stages of what's called the exercise as medicine movement, which is the movement now, but the initial stages of that actually root back to the 1950s. And I could actually go into that whole discussion and the story of how that all came about. But that's the health is wealth mantra that came from the 1950s, from the scientific community then. All those data points are going to suggest you need a combination of some sort of broad strength training and broad endurance thing. Now, if you have a specific goal 5 months from now, you want to compete in a race or hit a certain physique thing, that's fine to focus on one area of training. Certainly if you're an athlete, that's different. But if you want to maximize health and overall functionality throughout time, it needs to be a combination. And to really, really highlight this, I can actually talk about a couple of studies that I've done. One of them we actually did in Stockholm, Sweden. So I did this at the Karolinska Institute, which you probably are aware of. It's actually one of the founding places of all of exercise physiology. Generally, it started there. It was called something different back then, but really our entire field came out of Stockholm and the Karolinska Institute. And we worked with a whole bunch of cross-country skiers that were in their 80s and 90s. And so they were competitive skiers in the 1940s and 50s, and they had been skiing competitively for that entire duration. So you're talking 50 to 60 consecutive years of competing. So these are 80 to 90-year-olds living alone and healthy, and we compared them to a group of individuals here in America who are the same age, but were not exercising. And what we wanted to do is to see and kind of look at what are these lifelong endurance individuals? What do they look like? When we brought them into the lab, which is, by the way, amazing, to do a VO2 max test on a 92-year-old, especially in a language that they don't speak. You can imagine you're doing this in the hospital, right? And you're running people through, this is a cycling test. And so for a VO2 max test, you have a mask on your face. You're hooked up to a metabolic cart so it can collect all the gases that are coming out of your mouth. And you're chanting these people on, and basically every minute the workload gets harder and harder and harder until you can't complete it. And we're doing this in a cardiology center, and the cardiologists are usually waiting for their heart rate to get like slightly elevated, and they stop them because they're 85, 86 years old. And not only are we not stopping them, but we are screaming in their ears, just like, go, go, go.
In Swedish or English?
In English, right? And then the translator, but it doesn't take a lot of translation when someone's screaming at your face, like, go, go, go. So we ran them through a whole bunch of VO2 max tests, and we did the same thing for those folks back here in America. And what was incredibly clear from that study was the VO2 max, you can think about these numbers, and this is what's called relative. So in the relative terms are milliliters per kilogram per minute. And so a standard number is about 18, is what we call the line of independence. So if your VO2 max is below 18 milliliters per kilogram per minute, it's very hard for you to live by yourself. So your fitness is so low, you probably are going to need to have somebody living with you, or you'll need to be in some sort of assisted living home. So if you are in like the VO2 max of 20 or 21 or 22, you're not below that line of independence, but you're on that threshold. And so what we found was our folks here in America, the group average was right around that number. So they were living at home by definition. We picked them to be people living by themselves in their 80s and not in a living room. But they didn't have any bandwidth. So if they got a cold or they had anything pop up where they lost a little bit of fitness, they were going to drop below that line and would probably have to go to some sort of assisted living situation. The folks in Stockholm, the cross-country skiers, the group average was most closer to like 35 to 38 milliliters per kilogram per minute. Now that number is about the VO2 max you would find for a normal college male. And so these folks that were literally 80 or 90, if the joke, if a saber-toothed tiger ran in the room or whatever and it chased it down and we all had to run to see who didn't get eaten alive, the college men would probably have gotten eaten before the 90-year-olds. And in one case, we had a 92-year-old individual, and I think his VO2 max was 38, which was, in our estimation, a world record, the highest VO2 max for somebody over the age of 90.
May I ask, what is the typical resting heart rate for somebody very fit, like these older Swedish cross-country skiers? If somebody has let's say their number is 35 milliliters per kilogram in this VO2 max test, but since most of us don't have access to that kind of equipment, but we can measure our pulse rate.
Yep.
What was a typical resting pulse rate?
Sub 60.
Sub 60.
Yeah. I mean, typically that's a good number to go off of for anybody, regardless of age. Anytime I see somebody above that, I'm going to start asking questions. Certainly above, you'll see in the literature, people will say 60 to 80 is normal, and I don't agree with that at all. If your resting heart rate is 75 beats per minute, there's either something going on or you're not fit.
How much cross-country skiing were they doing on average in the previous, let's say, if we take the previous 20 years, since they'd been long-time cross-country skiers, divide that by 20 years.
Yeah.
On average, are these people cross-country skiing 5 hours a day, 2 hours a day, an hour a day?
Yeah, that's actually a good question. I don't remember. It's been many years, but they were not doing it every single day, and the volume would not have shocked you. It was the consistency over 50 years that got them there. Now, obviously, these people were, again, world champions and Olympic gold medalists in the 1940s and 50s, so they were elite. They just continued consistently over time. But it wasn't a shocking amount of physical fitness. They also didn't go out of their way to train hard. They were busy chopping wood. They were busy doing a number of other things, and then they just happened to do some of these races and ski along the way. But it wasn't a crazy amount to where you're like, oh, that's great, but I could never hit that number. It was something much more reasonable.
So is the takeaway to be consistent about getting cardiovascular exercise, and we can define what consistent means in terms of days per week a little bit later, and I know we will.
Yeah.
What are some other examples? I love these examples of from the real world.
So here's the downside, though. So I only told you about their VO2 max. What I didn't tell you about is their leg strength and functionality. And that part was no more superior than it was their counterparts who were not exercisers. So what that showed really, really clearly, and many other studies have been done since then that look at the classic, what we call lifelong endurance exercisers. You will see, in general, their VO2 max, their cardiovascular function, their resting heart rate, their blood pressure. It will be markedly healthier than folks who don't exercise. It is extraordinarily clear that type of exercise is very important for chronic disease management, no doubt about it. However, it is not sufficient for overall global health because it does almost nothing for leg strength, for any other marker of health, which we can talk about what are the things that are actually going to predict mortality, morbidity the most.